Hi, everybody. You are listening to the Medea podcast series. Medea Medical Education Academy is a global medical education provider dedicated to designing, delivering, and evaluating medical education programs worldwide. Today, we will be speaking with Ida Vanessa Doederlein Schwartz, full professor in the Department of Genetics at the Universidade Federal do Rio Grande do Sul, a professor in the Postgraduate Programs in Genetics and Molecular Biology and Medical Sciences at the Faculty of Medicine of the Universidade Federal do Rio Grande do Sul. At the end of the podcast, learners should be able to outline best practice for newborn screening for PKU. This podcast is part of the continuing medical education program entitled PKU Blended Learning Journey 2025, targeting specialists in paediatric and adult inherited metabolic disorders, dietitians, nutritionists, clinical biochemists and geneticists, basic scientists, psychologists, gynaecologists and obstetricians, nurses and all healthcare professionals helping those with PKU. All materials will be suitable for all geographic regions.
My name is Ida Vanessa Doederlein Schwartz. I'm a medical geneticist based on the city of Porto Alegre, Rio Grande do Sul, very south Brazil. And I work on metabolic diseases in research and also seeing patients since I was graduated in medicine, so in 1994. Currently, I'm also a full professor on genetics at my university and the president of the Brazilian Society on Medical Genetics and genomics.
Can you describe the issues you are facing in Latin America, in particular in Brazil, that impact your national screening program for PKU, please?
Latin America, as Brazil, is a very diverse and heterogeneous region. And we have in Latin America some countries that have very well developed newborn screening for PKU, such as Chile, Uruguay, and Costa Rica. But we also have some very poor countries which have a very high infant mortality and like a very high rate of primary malnutrition, such as Haiti, for instance. And these countries, because of the economic situation, they even have newborn screening program implemented for any disease. So one of the main challenges that we have in the region is the socioeconomical challenge, because as we have very poor people in the countries actually, as the economic resources are scarce, they have to put more efforts in providing more food to the infants and even a better perinatal care before they really put efforts in the newborn screening. Because when we talk about newborn screening, of course, we are not only talking about the test per se, because only diagnose a disease by the newborn screen is not enough. We know that for PKU, for the early diagnosis really be effective, we need also to provide education to the families and also to the society, and to provide access to treatment. So this discussion about newborn screening or implementation of newborn screening on these countries came also together with the discussion of providing education and access to treatment. Brazil, I have to admit that we have like a privileged situation, because we have a very good, we call Brazilian National Newborn Screening Program, which was implemented late as a national policy, was born in 2001, almost 40 years after the implementation in Europe and in US. But what we have in a good way in this program is that the program is public, so it is provided by the government, and we have this idea that it's not only the test which matters. So the program covers the diagnosis and also the follow-up and the management of the patients. For me to explain better how the situation of newborn screening of PKU in Brazil is necessary that I explain that we have a very strong public health system that we call SUS, which covers 80% of the population. But we have also a private sector, and I would say 20% of Brazilian population also have access to the private sector. So most newborns with PKU in Brazil, they were diagnosed through the public health system. And in the public health system, the diagnosis of PKU is performed not at the hospitals, but in some basic health units. So after the child is discharged, so the test is collected between the third and the fifth days of life. So during the first week, but not exactly in the first days of life. Why we do it? Because and this is a challenge, that's why I'm explaining that. In the public health system, we do not have access to the tandem MS machine. So the measurement of phenylalanine in Phe levels in the dried blood spot samples are not done in the public health system by tandem, but through other quantitative techniques, such as fluorimetric methods. But for those techniques, we have to collect the samples a little bit later, so between the day 3 and day 5. And this is one of the reasons why actually the first appointment of a Brazilian patient with PKU, so the real data when they start the treatment is a little bit late. Our data suggests that it is about the 30 days of life, so on day 30. But when the patient is diagnosed, he or she has access to the metabolic formula, as we call here, and also to dietetic orientations through the health system. So the metabolic formula is reimbursed, but no the low protein food. So we don't have the low protein food reimbursed by the public health system. And in the private system, the newborn screening is not seen as a program. So the private system pays for the test, and you can do the test by tandem, and you can screen many disorders in the private system. But the private system does not pay for the follow-up, and also does not pay for the treatment. So what happens is that the patients who are diagnosed in the private sector, after the diagnosis, they migrate to the public sector to receive the treatment. And we have some problems in this process of transition from the private to the public sectors, because in the public sectors, we have national reference centers for newborn screening. So hospitals and health units which work on newborn systems, so they are very well educated on the topic. But this is not the same thing on the private sector, where this theme like newborn screening and even PKU is not, unfortunately, still not well known by the health professionals. So summarizing, we have as a challenge in Latin America, speaking like in the name of the all countries, the poverty, the economic resources, which are scarce. And in Brazil, we have as challenges this dialogue between the private and the public sector of health, which sometimes do not work well. We have the problem of the inequalities, because we have some regions in Brazil. We can talk about Amazon, where it's very difficult to even arrive to the persons, because all the transportation depends on rivers. Okay, we don't have roads. And regarding education, we also have a lack of professionals, really experts on this topic. And I would say that mainly dietitians, okay? We are doing some efforts to have more actions in the dietitian schools for them to really be able to follow the patients. And as the last challenge, all the topics related to the access to treatment.
In your opinion, what is needed to remedy these issues?
My opinion is that the first thing that's necessary is a better education on the topic, as I told you. We have to have more classes on health universities, not only for physicians, but also, as I told you, for dietitians, even for social assistances, about the real importance of newborn screening and the early diagnosis of PKU. I would start doing educational things for health professionals, but the society as a whole has to be more informed about this topic, because we depend here of the knowledge of the politicians about rare disease in general, and particularly on PKU, for us also to be able to get some other advances, such as in the case of PKU, to have access to other types of treatments. As I told you here, only the amino acid supplements or the metabolic formulas are reimbursed by the government. Regarding sapropterin, currently we can use sapropterin only in women who are responsive and are to be pregnant. So this is still very limited in the country. Thinking of Brazil, okay, I'm not talking about Latin America in general. I think education is one of the main things to provide. And the second thing, of course, is to fight for the government to put more resources in this area in order we are able to have a better coverage and access to treatment. I have not commented about it yet, but the coverage of newborn screening in Brazil is not 100%. It varies across the country. So the richest regions in Brazil, that are the south and the southeast, they have a coverage of about 100%, but regions such as the Amazon and the North region, this coverage sometimes is between 70 and 80%. And we have some papers also suggesting that there are other inequalities that we have to fight against, like the coverage is higher if the family has a better income, and also if the family has a higher educational level. And this is linked to the issue that I brought before about education.
What is the impact on patients and parents of the imperfect screening process, and is the impact equal across the population?
Scientifically speaking about the impact, what we have published is the data about the coverage. We know for sure that newborn screening for PKU is lower in people which has a lower income and lower levels of education, but we don't have data regarding clinical outcomes, like if the disabilities associated to PKU higher in those groups. But probably the main thing is that we still have some patients who are diagnosed later, so who escape from the newborn screening, and this is very, very serious and sad. There are many reasons for what this kind of things can still happen in Brazil, but it still happen. And of course, if we have a late diagnosed kid, the main thing for the family and even for the kid is the possibility that the kid will have some kind of neurological impairment. We are able in Brazil to start the treatment for PKU even for late diagnosed patients, and we also understand that the treatment is for lifelong. But of course, the outcome is better if the treatment is initiated earlier. So the burden of the late diagnosis is something that will affect the patient and the family for the entire life. As the newborn screening program was implemented as a national policy only in 2001, we still have women with PKU, with milder forms, who are not recognized, who doesn't know that they are carrier, that they have PKU. So we also have children with maternal PKU syndrome in the country because the mother was not recognized before as having PKU because they were not screened. Okay, so this is the second thing. And also, I will use here the term fight because we have in Brazil PKU parent associations, and they have to struggle with the government to improve the access to other types of treatment, okay? So they are doing this part, but of course, this kind of things can also impact them negatively. We also do not have data on the quality of the PKU treatment in the country. I told you that the government reimburses the metabolic formula. We have some data suggesting that the lack of adherence to treatment here in Brazil, maybe it's a little bit higher than in Europe and in the US. And it happens also because sometimes there is a lack of providing this metabolic formula to the patient. So the government should have bought the formula, but there were some bureaucratic problems and the formula is not bought. This is something that still happens. So at the end, what happens is that we can have kids who are regularly treated and some other kids who are not regularly treated. So nationally speaking, we are doing some efforts to really evaluate how patients are in terms of neurological outcomes, because we have some clues which suggest that maybe our kids are not so well as they should be if they really followed the treatment.
What take-home messages do we have at the end of this podcast?
The final message, the first one, is that Brazil is a very large and heterogeneous country, so it's very difficult to implement a national policy which really works in terms of equality. Okay, so we still have many inequalities in terms of newborn screening for PKU. However, we have a good public health system which understands the importance of the newborn screening for PKU. But unfortunately, until now, the main efforts are still centered in providing the test, but we still have many things to improve regarding the follow-up of the patients, okay? And for us to improve the follow-up and even the coverage, what we have to do is to work together as a society, educating people regarding the importance of the newborn screening for PKU and the importance of the maintenance of the treatment.
Thank you for listening to this Medea podcast. For more information about our continuing medical education programs, please visit our website at medeaacademy.com.